Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. Both Dr. Henry and myself would like to thank the team that are helping deliver our updates to all of you. You may be most familiar with Nigel Howard, who's somewhere beside me over here, and who's often on camera, but he works regularly with Sarah McFadden, and they make an amazing duo, and it's really a team effort, as I think Nigel would be the first to acknowledge. And to the entire team, Scott, Jennifer, Nicole, Tyler, Jessica, Susie, Piper, and Christy, thank you for all your work. We're honored to be here on the territories of the Lekwungen-speaking people of the Sungis and the Esquimalt First Nation, and happy to introduce Dr. Bonnie Henry.
Thank you. Good afternoon. For today's BC COVID-19 update, I will report that we have 27 new cases who have tested positive in the province in the last 24 hours, bringing our total to 1,517. That includes 658 in Vancouver Coastal Health Region, 601 in the Fraser Health Region, 89 on Vancouver Island Health Region, 141 people in Interior Health, and 28 people in the Northern Health Region. We have, in addition, one additional long-term care facility outbreak reported in Vancouver Coastal Health in the South Granville Park Lodge. And as always, the list of the long-term care facility outbreaks will be included with the statement release. We have 20 other long-term care or assisted living facilities with ongoing active outbreaks, including 289 cases so far, 165 residents, and 124 staff. In addition, we have 3 additional positive cases at the nursery facility in the Interior Health, where we've had an ongoing outbreak and monitoring that Interior Health is doing with that premise, where we've had a number of temporary foreign workers who've tested positive. The facility outbreak at the Okanagan Correctional Center remains at a single positive case so far, but there's ongoing outbreak measures at that facility. And as we've talked about over the last few days, we have an ongoing and concerning outbreak at the Mission Medium Security Correctional Facility in the Lower Mainland. There are, as of official reports, there are 41 test positive cases. We know there's ongoing testing and cases pending, and we currently have 7 people from that facility who are in hospital in BC. In response to that, we've had an ongoing effort over this weekend to beef up the outbreak response, the infection prevention and control measures, and the investigation of the outbreak and management of the outbreak between the province, Fraser Health Authority in particular, and Correctional Services Canada. And as part of that, the hospital, Abbotsford Regional Hospital, has developed a dedicated unit to ensure that people can be safely and securely cared for, if need be, in hospital. And in addition, Fraser Health is looking at redeploying the mobile medical unit that we have in the province that is able to look after people in a hospital setting and include critical care if need be. This mobile medical unit has been set up at the Vancouver Convention Centre, but it will be redeployed to the Abbotsford area to provide additional support for this ongoing and very concerning outbreak that we have at the Mission Correctional Facility. In addition, right now we have 134 people in British Columbia who are hospitalized, and of those, 58 are in critical care ICU. We have an additional 3 deaths to report today, bringing our total of people who have died from COVID-19 in BC to 72. All 3 of these were deaths that occurred in our long-term care homes, 2 in Vancouver Coastal and 1 in Fraser Health. And our condolences and our thoughts and prayers go out to the families and the care providers for these people who have been affected by this virus. We have 942 people who have recovered fully in BC now. I want to talk a little bit about the pandemic response and want to thank a number of people who've been really actively engaged in helping us build our firewall that we will need to continue for some time to come here in British Columbia. First, to the mobile medical unit that I mentioned, who the team is going where the need is greatest at the moment, and we appreciate their flexibility and their expertise in being able to support our response. In addition, I really want to thank the many public servants at our land and air borders, people from the public service in British Columbia who recognized that we need a need and stepped up to a call for volunteers. And they're supporting travelers who are coming back to BC to self-isolate. They're assessing their self-isolation plans and ensuring that this is done safely so that everybody can meet what we need them to do, our expectation that they self-isolate for 14 days. We are in this together, and this is our way of supporting other British Columbians who are coming back home. And we need this for now, and we need this for our future, because this is going to be an important piece that we do going forward to make sure that if and when we're at the point where we can reduce some restrictions here in British Columbia, we're not reseeding or adding more sparks to our province in people coming from around the world. And so we expect that this border control effort will be going on for some time, and we were happy to hear that the federal government has now put in place an order in council that extends these same types of supports and requirement for self-isolation plans to all of the borders in Canada, as we feel that that is an important way for us to protect ourselves going forward from this virus. And just to give you a sense of the numbers, there are 2,337 arrivals over the last few days since this was put in place in British Columbia, and 24 people have been offered accommodations. Everybody else has been supported to self-isolate. So that, I think, is a big success story and an important part of our firewall for the future. Today as well, I want to recall and talk about the fact that COVID-19 is not our only public health emergency in BC right now. 4 years ago today, we declared a public health emergency because of the overdose crisis, that it was affecting our communities, again, around this province, affecting our families, our brothers and sisters, our uncles, our friends. And this crisis also continues. I am acutely aware and continue to be acutely aware of the suffering and loss that is being felt by people who use drugs, by their families, and by their communities. Many have lost loved ones, and particularly the challenge of that people have around stigma and around the concern about accessing help and getting the help that they need. I want you to know that you are not alone, that we are not slowing down our response or taking our focus off the importance of being able to support people who use drugs and their families and our communities. We're not letting this crisis overtake the importance of our response to our overdose crises here and the work that we need to do to continue to support people who use drugs. We have teams that have come together to address these two emergencies and dedicated to providing support to people who are at risk of both of these crises. We are working diligently. There have been a number of movements already, and you've heard from Minister Darcy around this, around emergency housing options, and we are continuing to work on making sure that people who need those housing options are able to access them in the coming days. So people who are experiencing homelessness and other issues, mental health crises, along with their concerns around substance use, are able to get the support they need to effectively isolate, but also to care for their needs, their access to overdose prevention sites, the appropriate access to supervised consumption services, and some of these have had to be modified and changed, and that is a challenging thing. We've also increased and expanded our ability to provide people with pharmaceutical alternatives to what we know is an incredibly and increasingly toxic street drug supply. We also know that many of the more vulnerable people in this community are challenged now for even accessing the basics such as food. And there are many things that we're putting in place to support you and to continue to support you through these two crises. We want all of those who are living with substance use and addiction and other major health issues to know that you are not forgotten, and we are continuing to make sure that we have those safety nets in place for you. What you are doing today and what all of us in BC are doing is making a difference, and it matters. And there have been incredible sacrifices, and we are very much aware of that. But your efforts and the efforts of everybody in British Columbia to keep our communities and our families safe and to contribute has made a difference in our collective well-being. So as these crises continue, I want to remind people to take care of yourself and to take care of those around you. Everyone, we all have a stake in this, and we need to continue to look after ourselves and to look after our communities, and to remind you to be kind to each other in doing this, to be calm and to stay safe.
Thank you very much, Dr. Henry. I wanted to join Dr. Henry in expressing my condolences to the families of the 3 people who died in the last 24 hours from COVID-19 in BC. All 3 are in either long-term care, in the long-term care assisted living sector, and living there. And that makes it, in many ways, all the harder, because those sectors right now are very difficult for loved ones to visit. And it makes, I think, the grief that many people are experiencing right now with people who've passed away, and that's in long-term care homes or assisted living homes, even worse, because the personal contact, the final moments sometimes aren't there. And I want you, and I know this is certainly Dr. Henry's view, but everyone's view who's working on the COVID-19 question, to know that we aren't living your grief in the same way, but we see your grief, and we wanted to extend our condolences to all of you. As Dr. Henry said, there are 134 people hospitalized with COVID-19 in BC today. 73 in Fraser Health, 11 in Interior Health, 10 in Vancouver Island Health, 3 in the Northern Health Authority, and 37 in the Vancouver Coastal Health Authority. And when we look at our acute care sector, that's 4,703 beds that are currently empty, and that represents means an occupancy rate of 58.1% across the system, and 45.7% in critical care beds in BC, and ICU beds and other critical care beds. So that is the situation in the province. I wanted to thank all of the people who are working at 811. Again, yesterday, response times on average were well under a minute, and I know that they continue to do dedicated and committed work. I think it's also a reminder, and on this very significant day, the 4th anniversary of the declaration of the other state of emergency in healthcare in BC, the opioid crisis, to note what people are doing across the province. I want to note the statement released today by my colleague, the Minister of Mental Health and Addictions, Judy Darcy, and all of the efforts being made that are continuing to be made in that ongoing state of emergency, that ongoing crisis that has so affected our society. And so we have 2 states of emergency, and we continue to be hugely dedicated to dealing with both. I also want to say that there's, of course, a lot of other things happening in healthcare right now. And we've talked about surgeries, and I can say, and surgery cancellations and the decision to cancel elective surgeries. And to date, I can report that 13,938 surgeries have been canceled, and that is obviously a very significant thing. But what's also true is that there continue to be surgeries in British Columbia for people in emergency circumstances. For example, people who might break their leg, it will be set in emergency surgery, and other surgeries that may be elective in the sense that they're scheduled surgeries that are going on. I just wanted to note that in the same period I described, so 13,938 canceled in that period, 8,221 surgeries have been completed in that time, and a little more than half of them are scheduled urgent surgeries that required action right away. That's about 4,500, and the remainder were unscheduled or emergency surgeries for various reasons. But what it tells you is that people are continuing to work in other aspects of the healthcare system. One of those areas and one of the groups of people who struggle most, who we feel are people who are dealing with or who have family members dealing with ALS. And just wanted to note, for example, that we are contributing, and we're announcing or letting people know that this has happened a little while ago, that we provided $1 million to the ALS Society of BC to develop an ALS Centre of Excellence in Vancouver to help not only serve patients but in Vancouver, but also province-wide through mobile clinics. And it's an indication of the enormous pressure in some respects in healthcare right now, where people continue, because people who are living with ALS are, well, they may be unaffected, and hopefully are unaffected by the COVID-19 crisis, are dealing with a debilitating medical condition. They continue to require our support, and we're continuing to work on all of those issues, from the other state of emergency around opioid to many, many other issues affecting healthcare. I wanted to just say finally that what these cancellations of surgery, I think, remind us of is the need to be committed ourselves, to continue to be 100% all in on all of the measures that Dr. Henry has put forward over the last number of months, because there are people who are sacrificing a great deal, who do not maybe even choose to sacrifice, but are sacrificing now. And that requires of those of us who maybe are sacrificing less than that, an absolute commitment. People are struggling in every way, from economically to medically, with these circumstances. And what that tells us is that we have to continue to be 100% all in for those that we love and for those that we don't know, but those who are struggling in our society. And I ask everybody to recommit today, as every day, to our joint effort to fight COVID-19 in British Columbia. Je vais dire quelques mots en français, et puis on va prendre vos questions. Et je veux dire que nous annonçons 27 nouveaux cas pour un total de 1517 cas en Colombie-Britannique. Nous sommes attristés de signaler 3 autres décès liés au COVID-19, 2 dans la région de santé de Vancouver Coastal et 1 à Fraser, pour un total de 72 décès en Colombie-Britannique à cause de COVID-19. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Il y a une nouvelle épidémie dans un établissement de soins de longue durée à South Granville Park, dans la région de santé de Vancouver Coastal. Les 21 établissements de soins de longue durée et de vie assistée touchés, combinés à l'épidémie de Bylands Market, de Nurseries, totalisent 289 cas actifs de COVID-19. Et je veux dire finalement que les autorités fédérales ont confirmé 41 cas de détenus COVID-19 au Centre correctionnel fédéral à sécurité moyenne de l'établissement de Mission. 6 de ces personnes reçoivent des soins à l'hôpital. We're happy to take your questions.
Thank you. Okay, so before we move into the questions, please, as a reminder, press *1 to enter the queue. You are limited to 1 question. And please unmute your phone. You're not audible until we call your name. First question today is from Denise Ryan, Vancouver Sun.
Hi, Dr. Henry. According to your directive on April 10th, regional health boards are to establish working groups to facilitate the restriction of care aids to a single care home site. And these medical health officers may make exceptions to the single site rule. Fraser Valley currently has made an exception, stating there are no restrictions in terms of the numbers of facilities care workers can work at, except those care workers who are currently working in a home with an outbreak. Care workers and LPNs continue to travel between multiple sites in a single day, and sometimes using a single mask and single pair of gloves at multiple sites throughout the day. Based on these concerns, do you think you're doing enough to protect vulnerable care home residents across all health authorities, and will you establish a timeline for these health authorities to comply with your single site recommendation?
It's not a recommendation, it is an order, and yes, we do expect compliance across the province. Some areas of the province are ahead of others, and there has been some exceptions made in the short term Fraser Health is working on this and will be in compliance. And there is not, as far as I'm aware, a blanket there is not a blanket exception within Fraser Health. I think you are probably referring to orders that were in place prior to us having the system in place to come up with the approach that we're doing over the past a week to 10 days. So yes, it will happen. It is complicated and much more complicated in the Lower Mainland, where you're dealing with two quite large health authorities that have a number of facilities. I know Fraser and Vancouver Coastal are working on this right now.
Next question is Tanya Fletcher, CBC.
Oh, hi, Doctor. My question is twofold. Just wondering if you can outline details specifically of moving the mobile medical unit out to the Abbotsford area, what that will look like logistically. And on that note, with the Mission Institution outbreak growing, it seems prisons are facing the same issues as long-term care facilities. So is there a need for a non-movement order more directly targeted towards corrections employees, inmates, to ensure that they're not moving between even federal and provincial prisons?
Yeah, so there is not, as far as I'm aware, a movement between federal and provincial correctional facilities. We do have outbreak protocols in place at both. Clearly, the provincial ones we're much more closely connected to, but the Correctional Services Canada does have protocols that they have put in place over the past several months. And yes, it's a challenge, as we talked about yesterday. Once an outbreak starts in a closed facility, it's a very difficult thing to get ahead of it, particularly when people are living in close quarters like they are at Mission, for example. So we are working very closely with them on this, and that includes enhanced testing, making sure that the protocols are in place to recognize people and enhance infection prevention and control. Logistically, it's a matter of packing the mobile medical unit. It is designed exactly that way. This was a unit that we brought into British Columbia prior to the 2010 Olympics and was used as part of a contingency staging up at Whistler at Function Junction to support the Olympics, and was an incredibly versatile tool. It's been used since then in several occasions where to be a backup essentially to an emergency department in a hospital. We've used it through some of the crises that we've had around flooding and forest fires. So they are quite adept at moving it, and there's a cadre of physicians and nurses who work with the mobile medical unit who know how to reconfigure it effectively and have the protocols in place to be able to care for people. It's kind of an amazing thing, and it's a great asset that we have here in the province. So I'm really thankful that they're able to set it up, and they have been asking from the very beginning, and it is a resource that now is under the Provincial Health Services Authority, and they've been looking for where and how we could best support the COVID-19 response using the mobile medical unit. I will also mention that it was deployed to the downtown east side 4 years ago when we started seeing the dramatic increase in overdoses and deaths in that community. So it is a great asset that we have, and I'm really pleased that it's going to be able to support our response to, as you say, this very challenging outbreak at the correctional facility.
Next question is from Moira Witten from the Tyee. Go ahead.
Hi, good afternoon, Dr. Henry. Thank you for your time. With health authorities focusing on additional staff, like re-registering retired or fast-tracking trainee healthcare professionals, a significant number of international medical graduates are saying that they want to help too. What's your stance on fast-tracking accreditation for these graduates? And if you support it, how can government support professional colleges to do this?
Yeah, so I've talked about the international medical grads before. I think there's important roles that they can play. I think the challenge that we have, and where the colleges have a very important role, is making sure that people who are responding, whether it's recently retired people, whether it is international medical graduates, are not practicing beyond their skill set and their scope of practice. So that is where the college comes in. So international medical graduates can do a number of things, but this is not the time to start new training programs, for example, where they need supervision to be able to do certain types of activities. So there has been, the College of Physicians and Surgeons has a separate licensing or approval process for international medical graduates that do allow them to be part of the response in specific roles. So I think that's a really great thing. We know that, for example, they can be incredibly helpful in supporting the public health work that we do under supervision for medical health officers and others.
Next, we have Cindy Harnett, Times columnist. Go ahead, Cindy. Cindy, are you on hold? Okay, moving on. Keith Baldry, Global News.
Hi, Dr. Henry. Thanks for taking my question. I asked you about the changing view of ventilators a few days ago, and you talked about sort of mirrored the changing information we're getting about this unique virus. And since then, a couple of respiratory therapists have contacted us saying that they've got patients where the ventilators just simply aren't working, and they've had to resort to other measures. And some staff at Royal Columbian sent us a note saying they're using, I think it's called Optiflow. What do we know now about the virus that we didn't know before? Because those respiratory therapists say this is not behaving like an influenza virus.
Yeah, I think that's something that we've been saying from the beginning. This is not influenza, and it does cause a different type of inflammation to the body in many ways. And so this is not surprising to me. And as I mentioned, we have a group of critical care specialists, including our respiratory therapists and others who are involved in looking at the data from around the world. So we do know that a certain proportion of people will not respond well to a ventilator. There's also people that will respond to high flow oxygen, like you've mentioned. And we know there are some people who don't respond at all, and there have been use of extracorporeal membrane oxygenation, or ECMO, as well. So it depends on the individual. I don't think there's anything new about that. I know that they continue to evaluate information from around the world as we get more and more information around this, and it depends on the individual's clinical response.
Next question is from Brenna Owens, CP.
Hi there. I'm just wondering, Dr. Henry, if you could elaborate a little bit on the rapid testing, BC's own version of this technology coming out of the Ottawa company to rural areas where the turnaround time might be an issue. So kind of the timing of that rollout and what it will entail.
Yeah, so there's a whole bunch of tests that are in the works, and the vast majority of them are similar to the Spartan tests from Ottawa, which are nucleic acid amplification tests, or NAT tests as we call them. And so it picks up pieces of the RNA, the genomic sequence from the virus, from a swab that you either do through the throat or through the nose. And that is the test that the BC CDC developed initially. But the tests that are done at the BC CDC need to be done in a lab, and that's why it took us some time to roll out those tests. And we now do it we have 7 other accredited labs around the province, including Life Labs. So that has been helpful in terms of Life Labs having the transportation network and the laboratory network closer to the north and some of the more remote communities. But we have also been looking at other NAT tests, including ones that run on a platform called Gene Expert, and we happen to have those Gene Experts in BC. Not all provinces use that platform for other testing. So because we have it available and we have the tests available for that is our first step in deployment to some of the areas, particularly in the interior and the north, where transportation of specimens and turnaround time has been a challenge. We haven't written off by any means the Spartan test, and it's nice because it's all self-contained, but it is a very similar type of test. So if and when it becomes available to us, we're looking at where it would be deployed as well in our province to supplement the testing that is ongoing now. But my understanding is they wouldn't be available to us till sometime a few months from now anyway. So it is absolutely part of our our whole plan of looking at how we can scale up testing, but we're currently focused on the ones that we have in province at the moment.
Ashley Legasic, CFJC.
Hi, Dr. Henry. Thanks so much for taking my question. Yesterday, you used BC Ferry's data to support the argument that most people stayed home over Easter weekend, but residents in the Shuswap tell us their community was bumper to bumper with tourists last weekend, many of whom had Alberta license plates. Will it be up to individual communities to prevent these influxes like the village of Tofino has done with their roadblock?
I think if you talk to the village of Tofino, they don't actually have a roadblock, and they will say that most people who are there have a legitimate reason. I think there's a lot more concern, and we need to be thoughtful about people and not just assume because you see a license plate or you see somebody you don't recognize that they don't have a valid reason for doing what they're doing. There's no benefit, and we've seen that around the world, from trying to block people from coming into an area. It's not going to prevent the transmission of this virus necessarily. Having said that, what we want is everybody to lay low and stay home. But you do need essential services. We do know there are people that, for example, we know there's a bunch of students this past weekend who finished their university and are returning home. There are legitimate reasons why people may need to check up on family and friends. So I would just say, be patient. Don't assume that people don't have a legitimate reason to be somewhere. I don't know if you want to talk to that as well. Sure.
Just to say that I think what's happening in BC is that overwhelmingly, and we see this, overwhelmingly people have heard the message from Dr. Henry, and they're following both the orders and the advice that have been provided. And like everything else, when that happens, when people don't do it, it amplifies its significance because everyone's doing it, and many people are sacrificing to do it. So I think we just have to continue to be aware of this. There was a feeling, I know, in some places that was much stronger than the data from BC Ferries supported on the coast during the Easter weekend, where we saw on the main route a 92% decline over the previous Easter weekend in travel. And the fact that I absolutely agree that people in the Shuswap would have seen Alberta plates, but it's very hard to be comparative about these things. Both myself and the Alberta Health Minister, Tyler Shandro, spoke last week, and we continue to speak with one voice about people from BC not traveling unnecessarily to Alberta and people from Alberta not traveling unnecessarily to BC. But I do think that sometimes we've got to make sure that we're following the evidence, and that's what I think the direction Dr. Henry has led all of us in, to follow the evidence and to follow her advice. And so that's what we're trying to do. And as well, though, to be kind, to understand that we sometimes don't know other people's circumstances. And we have to be, in these times, I think, extra vigilant about being generous in times that are difficult for everybody.
Next question is from Victoria Chang, Ming Pao. Go ahead, Victoria.
Hi, Dr. Henry. In French, they use the hydroxychloroquine. Sorry about that for my spelling. And then, but out of the 54 people, four patients has died. So I wonder if in our province, if some of the experiments like that has been ongoing, or what is your opinion by using those experimental drug? What is the danger that we should be watchful for?
Yeah, so we've talked about hydroxychloroquine. There are other drugs as well that are being trialed in clinical trials around the world. All of them, none of them have proven yet to make a difference in terms of curing or helping people who have COVID-19 or preventing infection. So there is experiments, randomized controlled trials are what we need to help understand if somebody just got better on their own despite the drug or if the drug made a difference. So those are ongoing. There's a big international trial called Solidarity that Canada is participating and BC is participating in to help us understand which drugs work best for which people. There's some people for whom it may not work. There's some people that other drugs may work. And I think we need to be very careful with hydroxychloroquine as well, because even though it's been around for a long time, there are people who are dependent on it for their ongoing health, including people with rheumatoid arthritis and lupus. And it's a very important treatment for them. So right now, there's still what we call equipoise. We don't know if it is of benefit or not. And so those studies are ongoing, and as soon as we have a definitive answer, we will, of course, adopt that as best we can for people here in British Columbia.
David Molko, CTV.
Hi, Dr. Henry. I wanted to talk a little bit about the numbers of people hospitalized or in ICU. If you kind of look at the numbers, they're about where they were 2 weeks ago, and I kind of want to reach out to you and ask if those numbers kind of tell the whole story. And the reason is, one, we have limited, albeit a very deliberate testing strategy, and two, others who are enduring their symptoms at home or in long-term care. So my question to you is, do the hospitalization numbers reflect the big picture? And can you also talk a little bit about where we might be in terms of true cases?
Yeah, so stay tuned for Friday. I'll be presenting exactly that in some detail. Yes, I do believe the hospitalization is a much more stable number that tells us how many people are in that more severe group, and it is representative of how many people may be infected in the population. So we do use that to project a little bit, and we talked about that when I presented the modeling a while ago. And I will be updating that. It is a more stable number because people, even if we didn't know that somebody had COVID-19, if they have a severe enough illness that requires them to seek medical attention and be hospitalized, we will be able to detect and find them. So it is a good representative number of what's happening with our pandemic, with our outbreak in BC. So it is something we're monitoring carefully, and ICU is also a much more stable number, although that started a little bit later, so we don't have as many data points, if you will. The other piece around our testing, of course, we've expanded it in the last week and a bit, but as you can see, if you see the testing numbers, that it has not gone up dramatically. So that tells us some stuff too. That tells us about how many people are not getting sick right now, and we know a lot of that has to do with the influenza season fading away, which is good news because we now have less chaff to find the wheat in when we're looking for people who have this disease, which is also a really important part going forward. So right now we know that the things that we're doing and everybody is doing across British Columbia around social distancing, around cleaning our hands regularly, covering our cough, staying home and staying away from others when we're the least bit sick, these are making a difference, and that's reflected in the numbers we're seeing.
Marcella Bernardo, News 1130.
Hi there. I was hoping to ask the question today about the, perhaps Health Minister Adrian Dix can answer this, concerns that I'm hearing from teachers, educators, people in healthcare about the use of Zoom to conduct virtual conference calls and people being hacked, and whether or not that is the best way to try to do virtual healthcare at a time like this when a lot of people are tense about what's going on.
I don't know the answer to that. I know there has been some concerns expressed to us from some religious leaders about what's the right word? Nasty messages that people are hacking into Zoom meetings, which I think is really deplorable. I have not heard concerns about anything in the education or certainly not the healthcare realm, and I'm not sure that Zoom is what is widely used for the virtual care. There are many platforms that can be more secure than that.
I think, Marcella, there's more virtual healthcare going on right now than we've ever seen in the history of British Columbia, and I don't believe that's the platform that is being carried out on. And there's many platforms that are working very well with family practice doctors and patients. And the whole idea, I think, of the Zoom as we envision anyway, with many people participating, is not the idea of primary care medicine, which is to have private exchange and provide private advice. But I think a reasonable person would say that we're using more virtual care than we ever have before by a factor of several times, and that this is going to have important long-term implications because for many people it's succeeding. And I'll just note the numbers that Dr. Henry talked about today, the number of people who have recovered from COVID-19 at home with the daily support of public health and with the support of primary care doctors and nurse practitioners around BC, which indicates that those practices are working for people, whether they're telephone consultations or some form of video conferencing or virtual care. They're still they're working for people. So I realize there's been some complaints about Zoom as a technology and some concerns about it in education, and maybe others are way more qualified than I to speak to that. But in terms of virtual care, I think we're seeing some success, and I think we're going to take the learnings of this success forward, hopefully after we've got through dealing with this pandemic.
Emily Lazatin, CKNW.
Hi, Minister, Dr. Henry. This one might be for both of you. The number of empty beds reported right now is more than 4,000, and there are thousands of BC families worried about an outbreak at a senior's home where their loved ones might be. And yesterday, Dr. Henry, I believe that you said that most of the cases in the Vancouver Coastal Health region were in long-term care homes, but most were staying in residence and not in hospital. So if seniors do get sick, are they immediately sent to hospital and put on a respirator if needed or as needed, given that there is room right now? And the reason why I'm asking this is because there was a story out of Ontario that Global News did that health officials sent a document to long-term care homes saying that seniors in nursing homes should be kept comfortable if they contract the virus instead of being sent to hospital.
Yeah, so currently our practice is to confer with the family and with the senior themselves about their expectations around care, and these are challenging, of course, challenging discussions. So they are offered hospitalization and the full spectrum of care if they want. I think this is it's a challenging conversation that many families are having right now about advanced directives, about understanding what their loved one wants should they become ill in this challenging situation. So for the most part, people are not being transferred to hospital, although in some cases they certainly have, and they are offered all of the aspects of care that they desire at this point. We do have, and I think I've talked about this before, we do have an ethical framework that we've developed, which is posted online, and part of that is the ethical framework worked out for how we would allocate ventilators should it become necessary to have a process for allocation of scarce resources. And the underpinning of all of these really challenging and difficult decisions is about that all lives are created and seen as equal. And that's where we're starting with all of our ethical frameworks, including for ventilator allocation. But then there is some criteria that are objective criteria about people's ability to recover and other things that underpin how we would do that should we be in that position. And we are not in that position. We have not had to invoke the measures that we would consider around allocation of scarce resources at this point. And we're still in the final version of, there was some added additions being made to the ventilator allocation framework, the ethical framework underpinning that, and I do hope to have that published or put up publicly as well in the coming days.
So we have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon with all the details covered off. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Andrea Wu, Globe and Mail. Please go ahead.
Hi, Dr. Henry. My question is about BC's recent move to centralize staffing at long-term care homes and temporarily offer a uniform wage to all workers. I'm wondering which workers this applies to and how those payments work. For example, are contractors advised the new wage that they must pay and then they're reimbursed by the ministry? Does the ministry pay the workers directly, or is it some other method?
I will leave that detail to Minister Dix. It is complicated, and there has been a new agreement in place under the order for the duration of the pandemic.
And what we might do, Andrea, is just provide you with some of that information. But there is this has been worked out with obviously the players in the area, including unions and many of the care homes themselves. It's been worked out, but there is an agreement as to how this would take place, and it's to ensure that workers are kept whole in the circumstance, because we don't want that to be the primary decision-making point as to which facility is chosen and which is supported. We need to support care in all of them, but it's part of a basic agreement. We'll be able to provide you with some information about that.
That's all the time we have today. Thank you.